as the Thai government notified the public on Sunday of a further 143 infections in the country and one more death, bringing it to the total of 7. This is the week that will see people here prove themselves for what they really are. Those that self-isolate, wear masks and keep safe distance from others are completely different from the packs of COVIDiots that don't. As, along with the rest of the world, Thailand battles to control the epidemic, introducing travel restrictions and closing borders. For most, the worst they might suffer is a nasty flu. For others, it's far worse. And hospitals are geared up in every province to accept potential COVID patients. With all forms of entertainment and large gatherings banned, it's only the COVIDiots who believe that they're invincible. And they'll feed the virus here too. Several issues face our own region. With employment based on factories and tourism, both in the doldrums, unemployment has, of course, steeply risen for local nationals. Many have already fled to their home villages and towns as a financial necessity, despite warnings not to do so. Those who remain are, of course, entitled to government support, an income based on their taxed earnings, but for many they'll quickly hit the poverty line. And the virus for sure has hit the city, albeit in a minor way. A list of those who are or have been sick was released, and itemises the locations where the sick person had been active. They include a bar in Soi 6, which of course used to be the street full of bars, seeing visitors wander from one to another, and all encouraging close contact. And anyone who visited either the Café de Beach or the Kon La Fun restaurant on March the 15th, or Soi 6 Pattaya between February the 24th and March the 26th, is encouraged to self-quarantine for 14 days. 3 groups here, then, are of equal concern. Local nationals, who at least have a guarantee of National Health Service in case they're sick, expats who have regular homes to spend their time in wisely, and tourists, some of whom are stranded as flights leaving the country come to a virtual end by Wednesday. If for any reason you've overlooked insurance, it's still not too late. Most agencies are selling COVID-19 insurance for as little as 400 baht. We recommend AA insurance brokers. Details are available from their website and you can call them by visiting the site aainsure.net. Contact them and get covered. It's that simple, and the cover is available to tourists too. And for those who are here on a tourist visa that's expiring, the Thai authorities are more than supportive. There's no one legally here who can't be afforded assistance with their visa extension. Let's split you up for a moment into 2 groups. Those who have so far not applied for an extension and those who have. For those who came here on a regular visitor's visa, 30 days, and have not so far extended, it's a breeze. Go to Soi 5 Jontiem offices with passport, proof of where you live, such as a hotel bill, 2 passport photographs and your ticket details. Tents are provided for those queuing. Staff will quickly process and approve your 30-day extension. And for those of you who've already had one extension, go to your embassy website and online complete the form applying for a letter that's required by immigration to support your application. That arrives in the mail within a few days. The cost of a 30-day extension is 1,900 baht. That's the fixed price. If you employ an agency to assist you and you have your documents already in order, the usual price is 4,000 baht, which includes their fees and transport to and from immigration. What happens if flights don't resume after 30 days? Well, many have asked that question, and you can be sure that immigration here have already got plans to offer subsequent monthly renewals too. With hotels listing at super low rates, your delayed stay here isn't going to run you up a huge bill. That's if you're sensible. And your credit card or debit cards still work perfectly well in all ATMs around Thailand. Back to COVIDiots again, as locals have been less than impressed by many not wearing masks in public places. You're required to have a mask available for all passengers if you're in a car too. As at road stops, police may want to talk to you or test your temperature, and then it's required that all wear a mask. Most stores and all government buildings require you to wear a mask on entry too. Not only can it help you in preventing you breathing in contaminated droplets in the air, but those masks also prevent you from spreading COVID in the event that you have it without knowing. Anyone with breathing difficulties should contact a medical professional immediately. Self-quarantine and call 038 119 777. As always, supermarkets, markets, food stores, pharmacies and clinics are all open and food supply is plentiful. Shopping hours in convenience stores have been restricted, seeing them close late evening for security reasons, so best to shop during daylight hours. The virus is spreading for sure, and seen the government, army and provincial heads all asking the public to self-quarantine, travel only when needed, not leave their provinces and avoid social gatherings. No one wants to set a curfew, but one way or another, Thailand must see the numbers level off and dwindle. A link to the regulations regarding tourist visa extensions and an example of embassy contact details through the British Embassy are both posted on our Facebook page and the TV news on our website alwayspattaya.com. And with the reminder not to be a COVID-idiot, wash your hands every 30 minutes, wear a mask and adhere to social distancing. And the Met Office promising highs today of 33, dropping down to 28, a clear day. That is the local and national news from Fab FM. For videos and of course to keep up with Fabulous Pattaya, visit alwayspattaya.com.